Welcome to the most impactful week in the movement to end prostate cancer. We're so glad you're here. This event is about you and connecting with experts, advocates, and communities from across the country. Together, we are Zero Strong. Please join us right now for the virtual Zero Prostate Cancer Summit.
Hello, everyone, and welcome to our first ever virtual Zero Prostate Cancer Summit. I'm Zero CEO Jamie Burse, and I'm joining you from outside Boston, Massachusetts. I'm excited for all of us to get together over these next 5 days. And while we'd all love to get together in person, this virtual experience allows you to connect with experts and the prostate cancer community from the comfort and safety of your own home. There's more than 1,000 participants from around the globe joining us, and I couldn't be more proud to be part of our shared fight to end prostate cancer. We're kicking off the week with our keynote speaker, Dr. Mark Moyad. Dr. Moyad is the Director of Preventive, Complementary, and Alternative Medicine at the University of Michigan Medical Center in the Department of Urology. Go Blue. And he's no stranger to Zero. Mark brought his beautiful sense of humor and straight talk about prostate cancer prevention to last year's summit in Washington, D.C. Dr. Moyad, you've done almost 20 entries on COVID research over the last year, and we know that COVID has dramatically impacted treatment and testing of prostate cancer because many prostate cancer patients and other immunocompromised individuals are in a high risk group. So please tell us about your research and really how that impacts prostate cancer patients and anyone else who's listening who cares about what we've been going through this last year in the pandemic.
Well, I mean, long story short, I started in public health, and I actually did some work before I started working on supplement outbreaks and dietary supplements and nutrition. We did some work on parasites and infectious diseases. And there was one called Cryptosporidium that we published on in my 20s in public health, and it got into the water supply. It's still a problem in some areas when it gets to the water supply, and it was a significant problem. Normally for people who are immune competent, have a good immune system, it wasn't too much of a problem if you were infected. But during the time we were dealing with a lot of immune compromised, in the beginnings of the HIV epidemic and issue, there were a lot of people succumbing to it. So we had to do all this work very quickly on this little thing that you basically couldn't see that was in the water supply, right? So at the same time, following different epidemics and endemics around the world and their impact. So it came full circle in the past year when cancer patients who appear to be at higher risk of not only infection, but complications from COVID-19 should be made more aware of the situation. What's new, what's their options, what works, what doesn't work. I spent a lot of time in dietary supplements and nutrition, and what a lot of people didn't realize is that we're probably seeing more dietary supplements clinical trials being done at high profile academic centers on supplements and COVID in the past 12 to 18 months than I've probably seen in my entire career get set up. So all of these other clinical trials are going on, not just vaccines, not just antivirals. And, who keeps up with all of this? And we realized back in March, and part of this was very selfish in the sense that we were impacted by COVID. Friends were impacted by COVID. Physician friends were dramatically impacted in some cases, that somebody had to keep watching this as a watchdog and tell you what works and doesn't work. So I started writing a couple columns in March, all referenced. Suddenly one column at the Us2 COVID site turned into two turned into five turned into 10. And I think now there's 15 or 16, 200 pages. And mixed in there, peppered in there was, different techniques and different things that are going on in cancer and how those are impacted by COVID. So, today's talk is the same one I give to physicians and healthcare professionals on just what's new, because keeping up with what's new is a full-time job, but nobody's really assigned to it unless you volunteer for it, if that makes sense.
Absolutely. And we're incredibly grateful for you to volunteer and step up to pretty much write a book on keeping patients and everybody who's at risk for the pandemic.
Yeah, I mean, I have to tell you, Jamie, what people don't realize is that, we have incredible treatments for prostate cancer. Nobody disputes that. We could argue that prostate cancer has seen more progress in the past 5 years than almost any cancer, at least at the top of the list, right? That's the good news. So people are surviving, they're beating it. But my shtick throughout my whole life has been, well, but you have to have more of a holistic approach. You've got to make sure you're taking care of all parts of the car, not just one part. And the only way to live longer and better is to do that. Be at tip-top shape in terms of mental and physical health. We know that one of the top causes of patients with prostate cancer is cardiovascular disease. So we always like to say heart healthy is prostate healthy. We want equal emphasis and people to look at it more comprehensively. One of the most embarrassing, and I don't know who we should be embarrassed for, maybe it's healthcare professionals, statistics is that when you look at adult preventive vaccinations, just basic vaccinations, so I'll talk today about shingles, for example, or pneumonia vaccination or influenza, the compliance rates run about 33 to 50%. So we have, of the adult population, at least 1 out of every 2, and maybe a larger number are not actually caught up with their series. So we know these save lives. We know these can enhance quality of life, extend life, impact life expectancy. So one thing that's important going into COVID-19 is we already have very bad report card in terms of adults getting their vaccinations and realizing what vaccinations they qualify for. And if nothing else, I always like to say a good lecture means that you get 1 or 2 things, not 6,000 things. If you can walk away with 1 or 2 things, and one of the most important messages is after this lecture is over, besides the COVID-19 vaccine that you'll get, and you'll get this year, you want to make sure you go back to your primary care, your oncologist, your urologist. You go back to all these individuals and say, hey, are there certain adult vaccinations I have not received, and how do I catch up with those working with my medical team? And I bet you most people who are listening to this will still need 1, 2, 3 or more to catch up to where they are, and not just the COVID vaccine. So that's part of the main message today that doesn't get out enough, that we have a very poor track record for active surveillance, patients who are going to surgery, patients getting radiation, a very poor track record of pushing adult preventive vaccinations that we could qualify for right now and go into the primary care's office or the pharmacist or the Walgreens or CVS and get caught up now to protect yourself.
So it sounds like what we've been learning over the last year through the pandemic is we've known for quite a long time, as you said, and it's easy. I think it's easier for patients to understand who are at risk of prostate cancer or who have prostate cancer, that what's prostate healthy is what's heart healthy. It's almost easier to remember what's heart healthy.
Yeah.
So by putting those two together. But I guess what we're also learning over this past year is that what's prostate healthy or what's prostate healthy is also vaccine healthy, and vice versa. So to be
That's right. I just submitted a paper last night to a medical journal, and the very end said what's heart healthy is prostate healthy, and it's also turning out to be immune healthy. Exactly. So it's not as if we've got to make up some new recipes. If we follow the general rules and we're compliant, it crosses from head to toe. It takes care of the immune system. It helps your prostate health, whether or not you have a prostate, and it helps your heart health. And again, it's going after a better quality and quantity of life. Because if the goal was just to beat prostate cancer, we would be doing a lot better. But it's to beat prostate cancer and to beat the other things that in terms of probability might come up and get you over the next 10, 20 years.
So you can thrive during survivorship if you have it.
Exactly.
And being able to sit down and talk to you at our summit is an ideal time, because we just got news the other day that there's more ammunition in the battle against COVID right now, right? There's a new vaccine that just came out.
Yeah, so just the Johnson & Johnson vaccine is going to go on. It's going to be voted on, and I expect it to get approval. I expect it to have no problems. My approval in this case means an EUA, emergency use authorization. So what you'll see immediately is 4 million or so doses go out, tens of millions of doses going out in the next 4 weeks. This doesn't need special handling. It can be put in the fridge, and it's a one-shot deal, protecting people from death and hospitalizations and more severe disease. Data came out today suggesting it actually discourages transmission. This will now be the third vaccine out there. A couple others are right around the corner. Novavx is right around the corner. I mean, the news is getting really, really good. And in terms of the efficacy of these, and we'll talk a little bit about the variants, which are a little concerning, but at the same time, these companies are well positioned to create boosters or whatever is needed to move forward and go after this thing. So I couldn't be more excited. I mean, it's incredible that this is a year later and all this is happening.
It is incredible, and I'm incredibly thankful to have you join us again at the summit this year. And I'm really looking forward to what you have to share in your presentation. So,
well, I mean, it's okay. It's not that good, Jamie. I mean, it's all right. But the reality is, I mean, this is not fair. So to let the audience know, Jamie invited me last year to DC to do the keynote address. And I had to run, actually I had to go fly to see my parents in Florida right afterward. So I give the keynote address and I just kind of put together a bunch of slides. I didn't know where it would go. Like the same thing I'm doing today. I just put together a bunch of slides. We'll see where they go. And so we got this amazing, I'm sure Jamie paid for it, but I got this amazing standing ovation at the end of my keynote address. Do you remember that?
Yeah.
Okay, so I got this and people were hugging me and I thought, okay, this is a great way to exit. And then Jamie asked me to do another keynote address, but by Zoom. So how possibly can this stroke my ego at all? It's not going to be able to do that, Jamie. I'm not going to be able to get standing ovations and hugs and you're great, we love you. Instead, I've got to do this all, pat myself on the back. I get no audience support.
Well, we'll just have to look at the comments and the little hearts or faces and emojicons that people give. So that'll have to do.
I know it'll have to do. I think next time in person, we'll be in person again soon, and then we'll have to force everyone to give me a standing ovation again, so I can have that feeling once again.
I look forward to it. Not only for your standing ovation, but just to share the room with some other people and have some fellowship.
That'll be incredible. But what I do remember about last year is this was it was right before you were going to send out a number of individuals to go on to Washington and talk to their political representatives, if I remember. And these people were very enthusiastic. And what I said is I meant it. Like, we get to come up here and give information and look semi-pretty. But the reality is there's this group of people that are so dedicated. They go out there, they knock at the doors. I've done that myself. I did that in the first 20 years of advocacy. I've been an advocate now in prostate cancer for 30 years. And it kind of brings me to the point where I almost want to ask you a question, because a lot of people don't know. You have all these people that talk to their senators and Congress people, right? And they help move legislation. Can you just mention that for a moment briefly? Because it was an incredible thing to see this group of people ready to go.
Sure. Thanks for the question. Yeah, part of what we do at the summit, Mark, is we equip and get advocates ready to contact their members of Congress and their senators to talk about prostate cancer research funding. Now, a lot of people don't know this, but the DoD plays a pretty significant role in the war on cancer. They actually do funding for almost about 30 different cancers that are out there, prostate cancer being one of them. And so there's a program called the Prostate Cancer Research Program within the Department of Defense that does funding that goes out to all of these medical institutions, like where you're at, University of Michigan, and many other places across the country, to do wonderful work to be able to discover new treatments, to find new diagnostic tools, to better understand disparities around prostate cancer, so we can really do the best we can to attack it from that standpoint. And because of our advocates all around the country, we've really had incredible success over recent years. There's been 5 treatments for prostate cancer, for late stage prostate cancer, to come out of the Prostate Cancer Research Program. and a diagnostic tool that's been able to determine if you have a slow growing disease or if you have a rapidly growing disease, and what treatments might work, what types of treatments might work on your prostate cancer versus some others, to take sort of the guessing game out of it. So really incredible advancements, and it all really comes down to the hard work that the advocates put in to be able to call their elected officials and get this done. And one of the exciting pieces of news that we have this week at the summit, there are lots of pieces of exciting news, and we're going to dive into your presentation in just a minute, but we're going to push forward for another $10 million increase at the prostate cancer research program. So we're fighting to go from 110 million to 120 million. And that $10 million increase means we could be looking at 6 to 8 new, really innovative, bright ideas coming out of these wonderful medical institutions to be able to find new treatments and be able to understand the disease better. One of those could turn into the next treatment. One of those can save really thousands of lives and get us that much closer to turning prostate cancer into from a deadly disease into a chronic condition, so we can start to be able to zero out prostate cancer.
So if someone's watching this video later on and they say, wow, okay, that Moyad video is amazing and Jamie's amazing, and I just love those two guys, and I want to volunteer and be one of those advocates that come to Washington and talk in the future to my senator or congressperson, do they just call zero? Or, I mean, how does somebody who ends up watching this video, they want to be one of those advocates? I mean, how do they even take the first step with zero?
Yeah, there's 3 ways to do it. Some of you may be watching this on an app that we have, and just message us right on the app that you have on your computer or on your phone. If you're watching on social media, leave us a comment, and one of our staff will immediately reach out to you and get you involved. And or you can go to our website at zerocancer.org and get involved. All this week, we're going to be doing education pieces, and we're also going to be doing advocacy training pieces. And if you're just tuning in now, it's not too late to make sure that you get to be part of that advocacy track, because meeting with elected officials are going to be happening next week. So we're going to get you trained up this week, and then do the phone calls and the videos with elected officials next week, so we can be able to increase prostate cancer research funding. We're going to be fighting for increases to the prostate cancer budget at the CDC to be able to increase more awareness and education, especially for health equity, to be able to spread the word among communities of color. So we have a lot to do on the advocacy side to be able to improve and expand access to care around prostate cancer.
Yeah, that's what I've been impressed by with zero. You're sort of on the front line. You're right there in Washington, and you're always, it's very polite, it's very professional, and it's a nudge. And those nudges of 10 million here, 5 million there, 15 million here, they make a difference. I do have one more question for you, if you don't mind. I know this is about my talk, but this is important because a lot of people know zero and a lot of people don't know. Like, because prostate cancer advocacy is picking up, and they're trying to get a handle on these things. What's been very popular through the years, especially in urology and oncology, have been the races. Can you talk a little bit about those and where that's going to go, and just what those races are? And they raise money, but they're very popular. The attendance, I know before COVID at least, I would travel and give a talk, and someone would say, our zero race is coming up. So can you just give a quick heads up on the status of that? Because I don't know, and what that's going to look like in the future.
Sure. Well, BC, before COVID, we were in almost 50 cities across the country, had about 25,000 participants, and run walks that we did from Boston to LA to Minneapolis to Miami, and all points in between. And what we're looking at right now is that hopefully you're going to give us some hope in your presentation, that we're going to get to a point in the fall that maybe we can start to bring back some of these events in a way that is responsible and careful, not to put people in harm's way, but to be able to come out in a safe way to start participating again and some of our walks, whether that means spreading them out throughout the day so we don't come in close contact if we need to. I mean, maybe we'll get to a point where we have some kind of normalcy to it. But we have a lot of contingency plans put in place to make sure that people are safe, that they're able to come out and learn more about prostate cancer and come together. But in general, the run walk, and this will come back gangbusters when we're on the other side of this pandemic, because people will want to come out and be part of just something bigger than themselves, and come out and just have that fellowship. But the run walks are really critical in order to be able to build community. It's important, and it's part of the healing process. It's not just about the medicine or the conversations that you have with your oncologist or your urologist, or even your family, but connecting with the community and connecting with other prostate cancer patients and survivors who are going through the same thing, getting involved and taking an active role in the fight to end prostate cancer, by coming out and being part of the walk or coming out to the summit. That's really part of the healing process of saying, cancer's not going to get me. Prostate cancer isn't going to get me. I'm going to get it. And not only that, I'm going to take the fight to prostate cancer and be part of the solution and ending it. And that's what we do with the run walks. We go into each and every community to be able to build up a local presence and have people feel like they've gone through a very traumatic time in their life, going through a prostate cancer journey, but they don't have to do it alone. And they have the Zero family with them, that we stand shoulder to shoulder with them, and we invite them into that family to be part of something bigger than just themselves. So I really am chomping at the bit, and would love to get back to some of these events after COVID, so we can get together and have a lot of these great events across the country again real soon.
That's great. That's great. The last thing I would say, and I know you'd reiterate that, what's impressive about Zero is the staff and the board. Now, the reason I say that is you've got some amazing people, and you got some amazing healthcare professionals that give input. And that's critical because the healthcare professionals giving input, working with Zero, are really top notch, right? So I don't know what more there is to say about it. I'm sure you could add something, but that impressed me about when I went to last year's meeting, the groups of individuals that you're getting advice from that are help keeping up with the latest and greatest research news. I mean, these are the people at the top of their game. And to have access to that kind of A team, I don't know what you call it, they're all goats, in their own, I mean, there's only Brady, right, from Michigan, but we'll talk about that later. But that's also something else that the audience should be impressed by and realize that they're getting the latest and greatest information.
Yeah, they really are the greatest of all time, like you are, Mark, and we're lucky. I'm lucky personally to have an amazing staff. I get up every day and I pinch myself, and I don't know why they have me in the position that I'm in at this place, but the staff is phenomenal, and our board and the medical advisory board is just fantastic. And we're going to hear from some of them throughout the week. We've got Dr. Alicia Morgan's coming up. Dr. Kelvin Moses is coming up. Dr. Chuck Ryan from the University of Minnesota, he's going to be speaking this week, and many more. We're looking forward to it because you're right. They have a lot of great perspective.
Absolutely. And they're working together, and it's like an all-star team. Because I've been around long enough. I'm not that old, but I've been around long enough. Like I said, 30 years in this game, that we weren't always working together. Everybody was on their own island. That's changed dramatically. So anyway, I just thought I'd throw that out.
It is, yeah, we're coming together. It's like, it's like we're like the prostate cancer cause, and all of these great professionals coming together like you. It's like the 96 Bulls, or any one of the 6 Super Bowls the Patriots have put together with Brady. So.
Well, I was thinking more the 97 University of Michigan football team. That's the group that won the national title. And I think that's the only thing that really matters in terms of football, right? So I know you were thinking of that too.
Fair enough. That was the very next thing I was going to say. Right there on the tip of my tongue.
Okay. Well, I'm ready to start this thing when you are.
Let's learn what you got.
Hello, everyone, and welcome to the Moyad second annual keynote talk at the Zero Annual Summit meeting. I get to do 2 keynotes in 2 years. Who gets this kind of honor? Very few people. Only people who essentially are Michigan football and basketball fans get this honor. Otherwise, you don't get the honor. I get to give this talk, and they said, speak on whatever you want. Well, I've been doing a lot with COVID lately. And my understanding is that at some point after I'm done talking, Cal Ripken Jr. will come on. So really, probably he's more of a keynote than I am. So I'm really being brushed aside for Cal Ripken Jr. But I'll talk more about that in a moment. There's my information. This has been going on, 27 years as a Jenkins Polk Kempner Director of Complementary and Alternative Medicine Education at the University of Michigan Medical Center in the Department of Urology. I don't really have any hobbies. I used to give out my email more, but then we get 1,000 emails a month and then people get mad that I can't answer each and every one of them individually. And if all I did was answer emails, I wouldn't be employed. So I try to just get as much in and talk as much as possible. If I see you at any of the meetings, like I saw a lot of people last year at the Zero Summit meeting in DC, we love to answer questions there. Maybe my hobby is actually saturating you with the words breaking news so that I seem important. I've realized now when I watch news, everybody uses the word breaking news every 3 minutes, even if there's no breaking news, to get people's attention. And I just think it's going to be 6 months from now where no one cares about the word breaking news. We're going to care about some other type of news. But anyway, that's all my information. I'm rah-rah Michigan all the time. I grew up in this town. It's been my only job. I live on campus in a house that I used to deliver newspapers to as a kid, and I'm Aquarius and I like water sports. There it is. Let's talk about COVID, everything you need to know, but let's see. Okay. I do want to say thank you to the Zero team and you. Thank you for taking time out to hear this different type of lecture, just like last year when we did the lecture. I want to say thanks to all the people behind the scenes. There's a number of people working today behind the scenes. I just got a chance to talk to Mary and Jamie. And there's a lot of people that make us look good, and they actually do all the work. And I appreciate it, all the advocates, as I mentioned earlier, all the advocates that went out to DC talking to their Congress men and women, their senators. Every little bit counts. The squeaky wheel gets the grease in terms of, we probably have examples in the area of HIV, totally changed the game by putting more money into research, totally changed the game in COVID, breast cancer, and now to be alive to see that prostate cancer is moving in that direction is incredible. So thank you. So Cal Ripken Jr., since Cal Ripken Jr. is coming on later, is known as the Iron Man. I just had to do this for my own self-therapy. He's played in over 2,600 consecutive games, over 3,000 total games, the most home runs of any shortstop, if my memory serves me correctly, but at 6'4", like who's a shortstop at 6'4"? That's unbelievable. Mostly shortstops were shorter, hence the name shortstop, and over 3,000 hits. But I'm not sure he's as good as Mark Moyad, because I've probably watched over 2,600 Michigan sporting events. I've been to probably over 3,000 games or watched them on television. I have no home runs. I have a lot of hits when I was in T-ball. I'm 6'1", so I could argue that I'm just about as good as Cal Ripken Jr., maybe on the same level, because I watched as many games as he's played it. In order to really endear myself to the audience, I always start my talk by showing pictures of past and current dogs. This was Chauncey, he's a Shishan. I love this dog. This was a selfie that he took personally when I wasn't looking. He just wanted to be inserted into my talk. Here's our new little guy. He's a Morkie, and his name is Grazie. Grazie in Italian just doesn't mean thank you. It also means gratitude. And I think during the pandemic, watching the bad news and some of the good news, which we'll talk about today, it's great to have this little guy in our lives. I wanted to name him Mark, but my wife chose Grazie, and I think that's a good name. And here's my favorite time of the day when he actually sleeps, because I forgot what it's like. So both of our kids are now out of the house, so we're empty nesters. I forgot what it's like to have a little kid in the house, and the little kid equals energy. And when you're in midlife, this kind of energy is great, but it's also detrimental a little bit. it tires me out. I think I've been going to bed at 7:30 every night since we got him. Oh, and by the way, I'll always throw in a random Go Blue dog insert. This is one of our dogs that always loved to wear a Michigan jacket on game day. I know it's nauseating, but you know what? When you're keynote speaker, you get away with whatever you want to get away with. So it's going to be a full bore, sort of ridiculously covered talk on Michigan sports all the time, and there'll always be innuendos toward Michigan sports. So I apologize. I realize it's a disease. There's no cure for it. I constantly talk about it, whether we're winning or losing. All right, so what am I going to talk about? I'm going to talk about COVID update. And why talk about it? It's interesting when we do these updates, and you see the updates at the bottom, us2.org /COVID, about 15, 16 columns since last March. I think there's more information there than you can get almost at any site, apart from the established sites like CDC and the other ones. But it also talks about different prostate cancer treatments, and it's not 100% on COVID. It also relates into cancer because cancer patients tend to, we believe, be at higher risk of complications for it. And it's also impacted access to care. So keeping up with the latest and greatest is important, as we mentioned in the introduction. So it's critical that anybody watching this knows what's working and what's not working right at this point. And then if I have time, I talk about a little other things, update, miscellaneous, but I don't think I'll have time today. The real idea is to learn 2 to 3 new things is all you need. I love to call my talk a safe zone. Safe zone meaning I have no involvement with anything that I talk about, no involvement essentially if I bring up a product. So I don't have conflicts. The reality is that if we think something is great, it's because through research, we've seen it to be great. And if something is not so great, through research, we've seen it not so great. That's simple. So that's really the talk. And let's get started. First thing I want to talk about is history. I'm a huge fan of history. So whether talking to students, whether talking to other healthcare professionals, to talk about a little bit about history, where we're coming from medically, helps to be a better researcher. I think it helps to be a better doctor. I think it helps to be a better healthcare professional, just to understand the trials and tribulations of history, the pros and the cons. So I do like to talk about the 1918 pandemic, because I'm sure at that time, as people were going through it, they thought, when are we going to get out of this? In reality, it was so horrific. What people don't realize about that pandemic, and here's sort of a global curve of it, including reflecting what happened in the United States, the average age of mortality was actually around 28 years old. In fact, the group from the age of 20 to 40 had a mortality rate as high as any other and made up almost half of the deaths. So usually what you see in statistics is you see what's called a U curve when you see these pandemics. And a U curve means that the most vulnerable, generally the youngest and the oldest, tend to be at the highest risk of morbidity, of severe disease and mortality. What made the 1918 pandemic, again, really different, and we haven't been able to explain it, is that it was a W-shaped curve. If you see this W. So you had the very young, the very old, and also the 20 to 40-year-olds. Again, the average age of death was actually 28, and that brought up the W, the middle part of the W curve. So with COVID-19, what you're seeing is more on the heavy emphasis on one side of the U. So as you get older, a higher risk, but you're also seeing an unusually higher risk of problems and people have comorbidities, which we'll talk about. But the 1918 pandemic is interesting, again, because people thought as they went through 3 major waves, some people argue there was a 4th one, but there were 3 waves going over about 2 years. I can only imagine that people thought, are we ever going to get out of this? And that second wave was so devastating, but there was another 3rd wave in the spring. So at the time, you have to understand that technology has been unbelievable, because obviously there was no internet, there was no idea of just keeping up with the pandemic. In fact, what people don't realize is we call it the 1918 pandemic, the great influenza pandemic, and we know it was due to influenza, H1N1, it was a virus, right? But people don't realize that the electron microscope wasn't discovered until the 1930s. So there was a theory that it was a virus. Some thought it was a bacteria, but they weren't even sure what was infecting them, because we couldn't actually see viruses until the electron microscope came in at a later point. So they're going through this pandemic, just trying to get updated information, not sure what the infectious agent was, and not even having, standard antibiotics or antivirals. Over the past several years, the US government, along with several other institutions, actually were able to sequence the 1918 H1N1 virus. And it turns out that it may have been susceptible at that time to just basic drugs that are used now, like Tamiflu. So Tamiflu is a drug that if you get the flu and you're diagnosed within 48 hours, it can reduce the duration and severity of symptoms. But it's crazy to think now, looking back 100 years, that something as simple as Tamiflu might have had good efficacy in the 1918 pandemic. So some of the heroes of the 1918 pandemic should give us pause for today. And I find it interesting that a physician surgeon who was also health commissioner in St. Louis, his name was Dr. Max C. Starclaw. He was very interesting. That's the person over there with the mustache. The person to the right of him essentially is the mayor of St. Louis. And they became the paradigm of what's known today as social distancing, that everybody has their own role into curbing a pandemic. So as St. Louis began to hear that a pandemic was coming, within 2 to 3 days, they instituted social distancing. They talked about coverings. They talked about taking care of yourself, whether it's through diet and exercise. And they talked about, not congregating in large groups. And most other cities waited 16 or more days. And that 14-day difference was part of the explanation for some of the lowest mortality rates during the pandemic that you saw in St. Louis compared to any other city. An example was given in Philadelphia, where they actually had a parade during that time where they decided not to have that social distancing, and they suffered some of the highest mortality rates. So we call it the Starclaw effect in public health, meaning that what you do makes a difference. Whether it's wearing a mask, whether it's encouraging the use of masks, encouraging social distancing, not being shy to do your part matters in terms of how the pandemic continues or whether or not it continues. Because just like in St. Louis, we're seeing today that all these prevention steps matter. Oh, one more point I think is a beautiful point of history. These two actually were political rivals. They actually ran against each other in the mayoral race. And so it got a little heated if you look at the history books. But when Starclaw became the health commissioner and Keel on the right became the mayor and the pandemic started to occur, they sort of dropped their partisanship and they worked together to make the right decisions for St. Louis. And I think that's a beautiful historical lesson, that I don't care what side of the aisle you're on, when it comes to pandemics and promoting health, working together is the only thing that seems to make sense to me and should be the standard. But it's interesting, everybody is in search right now of what we call a universal vaccine, just one type of vaccine you could just get every year or so when it comes to the flu. Now, this is with the flu. So there are all these companies working on not changing the vaccine, but using the parts of influenza or the flu that are constant and seeing if we could just have a standard vaccine that could be given every year. And unfortunately, sort of breaking news the past few months, one of the ones that we were most excited about didn't work. So there's many other companies working right now to create a standard flu vaccine. We don't know if that's going to happen, but technology is amazing because not only does it evolve with pandemics and epidemics, we also have a group of people working on what's the constant in the virus that we could exploit and possibly utilize to go after these viruses. But this was a little bit of a setback, but I'm confident that some of our flu vaccines in the future will be outstanding because we have a number of companies like this and other ones working on them. So now let's just talk about COVID and coronavirus. Coronaviruses have been around since actually the 1960s. There's probably hundreds of them around, but 7 are known right now officially to impact humans. So I just listed them 1 through 7. The first 4 are interesting because the first 4 have been around since the day I was born. And they're responsible for about 15 to 30% of the common colds out there. The other ones that get the most attention, you probably have heard about in the media, called rhinoviruses. They make up 40 to 50%, a larger number. So coronaviruses have been out there. 4 of them have been out there that can cause the common cold, and generally mild symptoms. And then 2002, you had SARS, and 2012, 2013, you had MERS. And again, these were contained, but then in 2019, you've got SARS-CoV-2, or the virus responsible for COVID-19. But it's interesting that the initial coronavirus family members were responsible for mild symptoms, and now you've got these other ones that are responsible for much more severe symptoms and possibly mortality. And that's the history of this family. But the idea, there has been enough research going on with those other 6 members of the coronavirus family that I think will pay off in the next few years too, as pills are going to be developed against some of these agents. This is a coronavirus, and this is the coronavirus you see all the time. These are the spikes you see. And so this is a toy that actually we throw around the dog, but to me, it looked like a coronavirus. These spikes are exactly what attaches onto any cell. And then it essentially is brought into the cell and takes over the machinery of the cell. And the average number of spikes tends to be anywhere from 65 to 75, but this is based on preliminary research. And any one of these spikes attaching can then work itself into the cell and cause issues. The most important product of the coronavirus sits at the top. You can see the thing that says the S protein, or spike glycoprotein. That's what all the vaccines and a lot of the drugs are going after. That's one of the Achilles heels that you can potentially go after. Another thing I would like to identify that people haven't talked about enough with these coronaviruses is do you see this red circle here? See that? That's what's known as the envelope. And in fact, the word envelope is there. That's the red part. That's sort of that's the shell. That's the outer area. That's the peel. And what people don't realize is these coronaviruses are envelope viruses. And if you can break that envelope, it helps keep the genetic material there. But if you can break the integrity of that envelope, then the virus can't survive. So actually, if there are plenty of agents that I think will be developed that can essentially compromise that envelope, basically spilling its contents and then allowing it to not survive. But the coronaviruses and the COVID-19 virus needs that envelope to go and infect someone and to survive. And this is an important point, because if we can compromise the outer peel of that orange, if you can just compromise it, you can stop it. And so there's a lot of little things going on too, which we'll talk about in a minute on how to do that. But all the interest right now is on the mRNA vaccines. Moderna is about 95% effective. Pfizer BioNTech, Pfizer's collaboration with a company in Germany, about 95%. 2 shots 21 days apart versus 2 shots 28 days apart. And this is why I love to stay optimistic. And this is why you always have to expect the best and plan for the worst. People forget that at the very beginning of this pandemic, the FDA's threshold for approval on a vaccine was 50%. So one thing that I always learn in any sort of epidemic or pandemic or any situation is you've got to be very humble and realize that when something's novel, they call this a novel coronavirus for a reason, it's new, that a lot of us are not going to know what's going to happen until it actually happens. And that's okay. It's not because we're not smart enough to figure it out, just because this is new, and someone that thinks they know what's going on, but they've never seen this before, that's a little too arrogant for me. But 50% was the threshold. These came in at 95%. And so the question has become with these mRNA vaccines, now that we know the first shot seems to be so effective, why do we really need a second shot? Well, let me answer that for you in one slide. Do you need the second shot or dose when offered it? And Fauci said it very well. If you look at the difference between the degree or the intensity of response after a first dose and compare that to a second dose, the second dose has essentially 10 times higher the level of neutralizing antibodies, which means you get a much higher amount of antibodies, but it also a greater amount of breadth or diversity of antibodies, so you can really squash this virus. So if you're one of those that have the chance to get a second dose, you take that extra advantage, because not only have they seen a greater number of neutralizing antibodies, a much greater, significantly higher number, but more breadth, which meaning diversity of response, which means going after some of these variants. So the second dose is very important. Now, having received the vaccine, if you have, people have said, well, the second dose is when things can go wrong. You might have a little bit of a fever. You might have a headache. You might break out in a fever blister, which is the case here. I got a nice fever blister come out. I haven't had a fever blister come out in 15 years, but you can't look at it as this is a bad thing. This means your immune system is basically really gearing up. So the next time that you're impacted, if the virus should try to make or to grab hold, you really have your best defense. You have your military ready to go. So these are things we should welcome. If you have a little bit of fatigue, if you have a little soreness, a fever blister, these are not bad signs. These are very good signs. Now, a lot of people have also had virtually no reaction to the second dose. Good for you. It doesn't mean it's not working. It just means that in terms of side effects, these are positive indications, in my opinion, that the vaccine's doing what it needs to do to get you ready if a future insult should happen. But there's more good news in the front this week. You've got J&J vaccines. So you got your mRNA vaccines, and then you got what's called a viral vector vaccine. They just take a cold virus. There's another type of cold virus called an adenovirus. And they took one from humans that commonly infect humans. That's what J&J did. And they took one from chimpanzees. That's what AstraZeneca did. And so you take a simple cold virus and you essentially are able to, within the genetic material, when it's injected, allow that spike protein to be made, and then you develop an immune response. So it gets you primed and ready to go. This viral vector approach is also brilliant. So J&J is one shot. They're also testing 2 shots, but the 1 shot was highly effective in preventing death or severe disease. And as of today, it looks like it's essentially impacting transmission on 1 shot. And J&J can make vaccines very quickly. They're going to ship out 4 million if it gets approval or from the FDA, another 10 to 20 million or more within the next month after that. The big date is February 26th. We don't anticipate any problem whatsoever in them getting approved. And then we got another one out there that's effective, and we just keep going. But there's another type of vaccine coming, and I believe they will also get approval. And I am very excited about Novavx. It's 2 shots, 21 days apart, where you just basically, it's called protein-based adjuvant. So you just inject the protein, the spike protein. Again, there's no material in there that could ever cause you to get COVID-19. It's only a tiny segment. The rest of it is gone. That spike protein, what you can develop an immune response to. So 2 shots, 21 days apart. But a lot of times when you inject just that spike protein and leave the rest out, well, you have to leave the rest out because you don't want to develop COVID. But when you inject that, sometimes the initial response is not that great unless you add an adjuvant, which means you add a booster to it. So what Novavax did was they arguably developed a natural vaccine. They took a booster from a compound from the soap bark tree in Chile, South America. And they use that and combine it with essentially that protein, give you the shot, and you get a big response, and it jacks up your immune response. And the numbers now will arguably or should look as good as any of other vaccines out there, 2 shots, 21 days apart. We expect this to be out there very soon. But using this natural vaccine, I call it, the fact that they got their booster from a tree in Chile is just fascinating. So the big question we get are variants. I've been vaccinated, I'm getting vaccinated, but I'm reading in the news, there are all these variants out there that are going to make my vaccine not very effective. Well, don't get too scared about it, because the reality is a number of these vaccines have shown efficacy against these variants. And if other variants pop up that are a problem, these companies are poised to make boosters and to adapt. So you got B1.17, that's the UK variant. That's in the States. That was a big problem in the UK. And I'm excited that the vaccines will have efficacy against that. You have another variant that's out there moving its way into the US called the P1. That's from South America and Brazil. And then you got the one that's getting most of the attention from South Africa. We say they come from these countries, but in reality, these mutations can develop anywhere, B1.351. Part of the reason you want to be vaccinated is as you can get rid of this virus. When the virus starts to feel stressed and it's not eliminated entirely, they essentially become selective for mutations. In other words, all this stuff we've talked about, the masks, the hand washing, the vaccines, all of this can bring the numbers down and help bring those variants down so they don't infect other people. So everybody has a job to do. And of course, we're watching these variants, and so is everybody else in real time. But this is the first time we've been able to do that before. Can you imagine 50, 100 years ago? They had no idea that these things could be circulating. But in real time, we're seeing the variant numbers and whether or not we should be concerned and whether or not we should develop medicines or boosters against them. So of course, I'm confident that we're going to get this thing. But the public needs to be aware that they have not only a responsibility, but they've got options. So one of the things I heard a lot, and I still hear today, is, well, I had to wait too long for my COVID test, or I don't know where to go, or I'm nervous going into a certain place to get COVID tested. Well, right now, the FDA is also authorizing at-home test kits. So this one is from Costco. I actually signed up for Costco just to get the kit. You can't get it in the store, you get it online. So if you type in Costco COVID-19 test collection kit, this actually went through the FDA on an EUA, which means this is just a major company working with a lab, a Zova. And essentially I've got it here. It just comes in a box like this, and you just spit basically in a tube. You seal that tube, you seal up the box, you put it in a UPS facility on next day air, and you get your results within 1 to 3 days. And so this is a PCR test used with saliva. So you don't have to do nasopharyngally. If there are kids who don't want that thing stuck up here, you're stuck at home, you can order these kits and they'll walk you through the instructions, drop it off at a UPS box or a UPS service center, and it works. In 1 to 3 days, you get your results for people that can't go in for some reason and they are at home. And there's lots of reasons why people can't go in. For example, in my family, we had some elderly individuals who simply couldn't go into a medical center, so they had to be tested at home. Costco is a great company. Costco vets for quality. I used to talk about Costco. Again, I haven't joined Costco until now just to have this option, but they sell supplements there that are dirt cheap, and people say, well, they must not have good quality control. No, they have great quality control with their dietary supplements if you qualify for one there. Why are they so cheap? Because they have the ability to essentially negotiate these lower prices. So I always hear this term that you only get what you pay for. That's not true. And there are many cases where essentially sometimes paying less actually gives you more. And so whether it's supplements or some other products, this test collection kit, these tend to be pretty high quality items. This shows you the inside of the kit. It was so simple to use. We have a couple on hand when my brother came to visit us to get tested before he would stay with us. Here's another one that comes out. It's a nasopharyngeal. You just go to Pixel, kit comes in, you take your own sample. I say FDA authorized yesterday. It was actually a little while ago. The biggest problem with these is a nasal swab test. The biggest problem with these is I'd like to see them cheaper. They're running $100 to $120. But you will continue to see the price go down as more and more players come in the market. And I do feel that, I don't know if it's a year from now, 6 months, 3 months, you're going to see many at-home test kits that you send in yourself that are going to be outstanding. One other thing I want to mention the consumer can do, and the person listening, is we talk about masking up, and this is me going to grocery shopping during the pandemic. Still, this is what I do to do my part. But what gets missed is essentially eyewear. And I can't say this enough. So here's whether or not they're working glasses, tool glasses, something to protect the eyes. There are 3 ports of entry: mouth, nose, and eyes. And the eyes are the part that get missed the most. If you actually go into a store and a restaurant, in terms of seeing protective eyewear. And that's a critical entry point for the virus. So I wish more people would protect their eyes. It was early in Wuhan, China, actually, where they showed that healthcare professionals, and now we've also seen this in studies in the United States. There's a study in Texas that healthcare professionals just wearing eyeglasses. I'm not talking about just the facial coverings, just wearing eyeglasses to work or carrying eyeglasses around seem to reduces the chance of them being infected with the actual virus. And that makes sense to me. There's talk of a double mask, triple mask, you name it. I still think you do what you can right now to bring these numbers down so this all goes away. So have I started a double mask? I have. The reality is there was a recent CDC study showing how well double masking works, but what was missed in the coverage of that study was essentially the fact that it was assuming that the other people you come into contact with are using the same protective items, double masking, eyewear. So again, it might sound great to double mask or even single mask, but it's assuming in these laboratory studies that other people around you are also protecting themselves. So you're protecting you and you're protecting the people that come in contact with you. And so this study that came out by Brooks et al. On February 10th, again, was assuming that the people you interact with were doing similar things that you were doing to protect yourself and them, and that can help bring the numbers down. One thing that also got missed, I think, during the pandemic, which I like to talk about, is soap. I'm not talking about cleaning your hands just with soap and water. What we don't realize is that you'll see in studies coming out in the future that in all of 2020 and maybe 2021, adults like myself and kids will have washed their hands probably 10, 100, 1,000 times more than they'll ever wash their hands again in the world or in the United States. What does that mean? That means when you're washing your hands that much and you were never used to washing your hands, some people who have hand sensitivities or skin sensitivities like eczema, for example, and some people don't even realize they have it, they are very sensitive to compounds and chemicals in soap. And the greater you irritate the hands by washing, essentially the greater the exposure, what I think you'll also see is a higher rate of what we call allergic contact dermatitis. So one of my tips early on in the pandemic, and I wrote a column about it, was the cheapest types of hand soap, the fragrance-free varieties, are the ones that are all over our house or anywhere that I recommend to people. So if you look at the back of, for example, 365, that's a Whole Food brand. I found it interesting that during the pandemic, you could buy every variety of fragrance out there, and most of them were almost sold out. The regular foaming or liquid hand soap that had no fragrance in them, that said fragrance-free, they were loaded with them. So people were buying all the ones with the fragrances, but the ones that we would think that people would be more excited about to protect their hands fragrance-free, that educational item wasn't getting out there. They weren't being purchased. So no parabens, no artificial fragrance, biodegradable ingredients. So for all of you who also want to be protective of the environment and want to protect your hands from developing a contact dermatitis, you've probably heard of latex allergies in healthcare professionals. You constantly get exposed, you break a barrier, and these are very strong autoimmune type reactions. You can have, very swelling of the hands, redness of the hands, and some people need treatment for that, and they need treatment for a long time. So the word of the slide is fragrance-free is the soap that I recommend. No fancy extras in there. What if the vaccine isn't 100% effective? In other words, I got this question a lot. Okay, what if the vaccine is not 100% effective? It's not 100% effective for everyone. Well, we've actually been in this position before. We thought when it came to HIV and hepatitis C that a vaccine, we could create a vaccine, it would take care of anybody. And the reality is we never got that vaccine in my lifetime, be it for HIV or hepatitis C that was 100% effective or just effective. But in hepatitis C, if you look now, the antiviral pills, more than 95% of the infections can be cured. I want you to think about that word. This actually comes from government websites and can be cured by treatment using a direct antiviral agent for anywhere from 8 to 12 weeks, for example. It's incredible that a virus that has caused so much damage around the world. And by the way, if you were born, the recommendation from the CDC and others, if you were born in the years 1945 to 1965, that was a high rate of when people got hepatitis C. It's a very quiet disease until it becomes problematic. So people should be tested for it, especially if they were born in those years, the boomers, the 45 to 65. But it's incredible to think that you take a handful of pills of a disease that used to be so deadly and still is. And the majority of those, 95%, you can now keep those viral loads to nothing or be cured by just taking them for a short period of time. It's amazing when it comes to hepatitis C. And that's why I have the ultimate faith in research that if there are certain types of coronavirus we can't get to, I think antivirals will be developed that you take it on the spot that will be efficacious. Another thing that's getting missed during the pandemic, which is a huge disappointment, and there needs to be more of a talk about it, especially to cancer patients, and I've seen this over and over again, is there are these great antibody treatments if you have symptoms. So if you experience symptoms and you're at high risk, you're a cancer patient, you're going through a variety of treatments, and you go to the emergency room or urgent care, or you talk to your oncologist, you talk to your doctor, ask them if you've been diagnosed. You got a PCR test, for example, or maybe you got a rapid test, you have the symptoms, and they've diagnosed you with COVID-19, and they're worried about it progressing or you being hospitalized. There are 2 antibody treatments that are available now for emergency use authorization. And I can tell you, as a 95-year-old friend, 65-year-old friend, I've seen a number of people that received either Eli Lilly or Regeneron. The past president actually got the Regeneron when things weren't looking good, got the Regeneron antibody product, and you get it over 1 hour. You get this infusion of these synthetic antibodies, and then it's 1 hour of observation to make sure you tolerate it okay, and then you're done. And I believe it has been a game changer for a lot of people who started in the first few days of being ill, especially for the first three days. So we call it like the Tamiflu of the pandemic. But the problem is there hasn't been a whole lot of coordination here. Some emergency rooms able to give it. Some researchers will determine whether or not you qualify for it. The bottom line is, if you're diagnosed with COVID, get on the phone, call your provider, and ask whether or not you qualify, or you have to go to an emergency room. And this is just not getting enough attention. The idea that anyone listening to this talk right now who gets sick or gets diagnosed with COVID has the ability to request an antibody treatment from either one of these companies, and may qualify for one. And that could be the difference between a mild infection from becoming a severe infection. We also have other antivirals just if you get the flu now. We don't just have Tamiflu, we have this thing called Xofluza. The only reason I mention this is that because the pandemic is getting all the attention, there's all these great things happening with antiviral pills that aren't. There's now a product called Xofluza. You take 1 dose in the first 48 hours of symptoms, and then you're done. And if people have had household contacts to that person with the flu, they also qualify for this 1 dose. So Tamiflu and Xofluza are equal in efficacy, but Xofluza was going to have a ton of commercials in 2020, but they didn't because COVID dominated the scene. But Xofluza is a 1 dose pill for the flu, not for COVID, but for the flu if you're diagnosed with the flu, and even in household contacts may qualify. And again, you want to take it as soon as possible, working with your doctor within the first 48 hours of being diagnosed. The interesting thing about these new drugs is you can't take many supplements with them, because a number of supplements actually bind to part of the active ingredient in the drug, and it chelates with that drug and can render the drug less effective. That's an important point. Which leads us to the point of COVID-19 supplements can't hurt, right? So probably my biggest pet peeve during the pandemic was with supplements when it came to research. We had so many experts telling us, and I call this insert your opinion now, oh, you got to take zinc, you got to take vitamin C, you got to take melatonin, you got to do this. And there was so many opinions and so little time with so little scientific evidence. And for those of you who know me, knows that I've been working in supplements since I was 22. I did a book on supplements, I've taught on supplements, you name it, hundreds of publications, and I'll put my supplement knowledge up against anyone. That's great. And then some people will get mad and say, why aren't you recommending supplements for the COVID pandemic? And I kept saying, because I have no idea if they help, harm, or do nothing. And anyone that says they harm, they do something great or do nothing, they don't know what they're saying, in the sense that we have no idea. So the truth was, I took a Switzerland approach until we got data. We have no idea if supplements can help or hurt against COVID, except now we have preliminary data in the past few days, which I will talk about. This is breaking news from the Cleveland Clinic. So these are patients that were not hospitalized, they were outpatients, they were diagnosed with COVID-19, and they were placed in one of four groups. A high-dose vitamin C group for 10 days, 8,000 milligrams. Think about that. I mean, you're supposed to get, if you're lucky, 60 to 90 milligrams is in the range of the recommended allowances, and now they're doing 8,000 because these high doses suggest they might have antiviral effects. And then there was a second group that took 50 milligrams of zinc gluconate, a third group that took the combination, and a fourth group that just did standard of care. What happened? The study was shut down and just published. They showed no benefit versus just kind of observation and standard of care, taking something for different symptoms. But there was a concern, especially in the vitamin C group. They saw a higher rate of stomach cramps and diarrhea, so abdominal issues. And even in the zinc group, you saw some issues too, but they didn't reach a level that was as high as the vitamin C group. So what am I saying? So far in the first major study, which came from the Cleveland Clinic, published in the Journal of the American Medical Association, they didn't see any benefit to taking high-dose vitamin C and or zinc. And the side effects are concerning. The side effects are concerning to me because some of these side effects can mimic COVID-19 symptoms. So if you have a side effect, whether it's a change in taste or whether it's a gastrointestinal issue, and some people with COVID get that, how do you know it's COVID versus the side effect of the product? You don't know it. Also in the past few days, Brazil did an amazing study. I thought it was really well done, where it was placebo versus one dose of 200,000 IU of vitamin D if you were hospitalized for COVID. So remember, the Cleveland Clinic study was trying to prevent you from being hospitalized, was trying to reduce the duration of your symptoms while you were isolated at home, and it did not reduce the duration of your symptoms. And now the Brazil study with vitamin D, what they tried to do was essentially get you out of the hospital faster so it wouldn't progress to more severe disease. So is it going to reduce the amount of time you spend in the hospital by being exposed to one single high dose of vitamin D versus placebo? It did not. So now our first two major studies in two major journals of high-dose vitamin D and vitamin C and zinc didn't show a whole lot, and there were some hints of some concerning side effects. Now, this is very preliminary. We might see some benefits for certain types of patients in the future, but right now, this is precisely the reason I did not want to come out like a bunch of other people and say, take this, that, take this dose, because nobody had any idea what any supplement could do against COVID-19 because it's a novel coronavirus. We hadn't seen it before. We would be just guessing. And we could refer to lab studies and other coronaviruses, and that's interesting, but we have so many trials coming out in the next few months, we're gonna have a better handle on this. So not only Cleveland Clinic did their study, Harvard's doing a study right now of vitamin D at different dosages. Mayo Clinic's doing a major study. University of Minnesota has been observing people on different supplements. There is some 100 different clinical trials on supplements. So we don't know how this is all going to end up. Maybe some might be efficacious, maybe none, maybe some of them will have a little bit of efficacy. We don't know how this is going to play out, but less should be more right now until we get more of an idea. That's been my opinion. Because I grew up at a time where everyone told me that more was better, and that was in the area of prostate cancer. And one of the largest supplement trials in global history was the SELECT trial. It was done throughout the United States, 35,000 healthy men. It cost taxpayers about $125 million, done at 300 sites. And the idea, it was set up because the thought was high-dose vitamin E and or selenium could reduce the risk of prostate cancer. And it turned out that vitamin E actually increased the risk of prostate cancer. Selenium had no impact. There were some other concerns, though, of people getting too much selenium and side effects. So more wasn't better. So I've grown up at a time where for 30 years it should pay off, where we have seen where people become experts and tell you that more is better, but we don't know more is better until it's proven to be better. And in prostate cancer, we have not seen that. And in COVID right now, we haven't seen that with supplements, but we wait for more research. Because right now, vitamin D is really hot. I mean, But this is all cyclical. If something becomes hot, they put it more in the food supply. They put it all over the place. In the old days, not that long ago, many decades ago, Schlitz talks about vitamin D in their beer to get you all fired up. So I understand it. If I had a company, I'd probably do this too, but that doesn't mean it's going to help you. It just means it sounds interesting. And the largest study of vitamin D to prevent heart disease and cancer actually just finished up in 2019. It was run by an amazing Harvard physician. Over 25,000 individuals for 5.3 years took 2,000 IU of vitamin D, essentially versus placebo, and it showed no impact on cardiovascular disease, and it didn't reduce the risk of any cancer. However, they are continuing to analyze this data because they did find one group that may have impacted. Those people with a BMI less than 25, it seemed to reduce their risk of metastatic or fatal cancer. Is this cause and effect? We have no idea. We know that they're going to keep pursuing this and looking at this. So vitamin D has been a bust so far in many areas, including heart disease, against depression, against diabetes. In the largest trial so far to prevent cancer, it didn't prevent cancer, but they've seen in people who have a normal BMI that it may have benefited them by keeping their cancer differentiated and not causing a fatal event. We don't know if this is true or this is luck because these people had basically a normal BMI. So was it the high vitamin D that essentially helped keep the cancer at bay in this study, or essentially was this just a consequence? In other words, just having more of a normal frame really provided that protection. This is just a bunch of noise. This is being figured out. But something else that happened in 2020 in prostate cancer and through all-out cancer with supplements didn't get any attention. I want to bring it attention right now because patients going through chemotherapy, and yes, chemotherapy for prostate cancer, there are all these things called ASCO guideline updates. They're sort of state-of-the-art, amazing guideline updates that tell you the latest and greatest in research. But I find that the ones that mention diet, especially supplements, don't get much attention. But they came out with a new update, which I completely agree. It says the use of acetyl L-carnitine, ALC, for the prevention of CIPN in patients with cancer should be discouraged. CIPN is chemotherapy-induced peripheral neuropathy. There are a number of chemo drugs that are used in prostate cancer that are amazing drugs, but they come with toxicity. And one of the potential toxicities is a peripheral neuropathy, a nerve injury. And they've been trying to study in breast and other cancers the use of a supplement to prevent that from becoming more severe. And it looks like in some of the bigger studies, especially one of the biggest studies, that not only didn't do that, it could have made it worse. So in the new ASCO guideline update in 2020, they said if you are undergoing chemotherapy and you're trying to prevent chemotherapy-induced peripheral neuropathy, CIPN, they discourage the use of this supplement, and it makes a lot of sense. Now that's the bad news. The good news is they're now looking at the possibility of other things helping this side effect of chemotherapy. For example, acupuncture is getting a lot of attention right now in terms of prevention in the area of preventing certain side effects, including CIPN. So stay tuned. That's on the positive side of things. So the whole point is I come up to finishing up in just a little bit here is too much of a good thing could be a problem just as much as too little of a good thing. If you're going to take a supplement or anything over the counter, spend your time doing the research to see with the clinicians and the medical team you trust, do you even qualify for that pill? And even if you qualify for that pill, is it a clean product? Because just because it's sold over the counter doesn't mean it's a clean product. You have to do your own homework to see if it goes through some kind of standards. And this leads me into the talk of marijuana and CBD. I call this marijuana CBD dude talk. Well, the reason I say that is because, I grew up at a time where a lot of people wanted marijuana legalized, and now we fought, and I wouldn't say I fought, but the reality is it got legalized, and now there's this specific component of it called CBD that doesn't give you the high effect, but may give you other benefits in the area of pain, stress, anxiety, and sleep. But this is all theoretical, a little bit of research. The reality is, after all this talk of CBD, there's still only one FDA-approved product in the area of very rare epileptic syndromes or situations in mostly the pediatric population, and it's incredibly expensive. So this is a product called Epidiolex. The other thing about CBD, which you should know, number 4, is it's heavily metabolized through certain systems in the liver. So if you're one of these people taking CBD or marijuana, and you're taking all these different types of prostate cancer drugs, especially the oral drugs, the anti-androgen drugs, talk to your doctor and look it up yourself about the latest and greatest about drug interactions. because a lot of these pills, these prostate cancer pills, are metabolized heavily through different systems in the liver, and so is CBD. And could there be a drug interaction? That hasn't been figured out yet. It's going to be figured out in real time. The most important point of this slide is number 3. Even if you're going to work it out with your doctor to get CBD or a product that you pick up at a clinic, always ask for a COA. That's a certificate of analysis. It means that what the product is advertising is actually the product that you're taking. It means they've gone through a third party that tested for things like heavy metals, mercury, lead, arsenic, tested for bacteria, fungus, these kind of things, tested for pesticides, herbicides. And that's true of supplements. You should always ask for a certificate of analysis, or ask, does the company have some third-party quality control system? Do they have a label where they allow people to come into the company and test their products? So what they're advertising to you is exactly what's in the bottle. And there's been some problem with that in terms of CBD. Number 6 is what beats placebo. What that means is it's like COVID research. You got to give it a little more time to really figure out what works better than a placebo. With over 150 plus ongoing clinical trials in marijuana and CBD and cancer, including prostate cancer, we're going to find out what works better than a placebo, because a placebo works pretty damn well. So does it beat placebo in a lot of these areas? Does it beat placebo for certain types of pain and stress and anxiety and sleep? We're going to find out by the next time I give this talk. There's going to be that kind of preliminary data. That's how much research is going on now. Last few items on COVID, just for fun. But it's interesting to me. I like cheap stuff. I'm a cheap guy. And I call it go after the envelope. One of the most interesting trials that are not getting attention is actually in the UK. It's called the Elvis Trial. Not the Elvis, you know, Elvis, like Elvis was spotted or Elvis has left the building. Elvis just means the Edinburgh Lothian viral intervention study. Can't even believe I remembered that. So there are all these clinical trials going on with saline mist, these saline sprays. And the reason they're testing saline to prevent infection is the idea that saline could break through that envelope of the COVID-19 virus. And that envelope we talked about earlier is very unstable. If it's penetrable, it's weak, you could destroy the virus. So this trial is almost over. I don't know if it's going to work or not, but Vanderbilt's also doing a similar study where essentially if you are at home and you were diagnosed versus a placebo group, you essentially use a saline mist, and some of the studies you gargle with saline water, and could that destroy some of the virus? I find it incredibly intriguing. We know these kind of things are recommended now for certain types of patients in the area of allergies, or when they have certain other types of nasal symptoms. And so I don't know if this is going to work, but man, it'd be great if this worked to prevent a mild infection from becoming more moderate or severe. But I have 2 simple future tips that I wish more people would know when it comes to COVID-19. Again, that was the point of watching this talk today. The things that you don't always see on television and all these other places. Here's the 2 most ridiculous tips I wish we would have talked about more. Know your baseline average temperature. Let me repeat that. Know your baseline average temperature, please. Why? Because even though we hear 98.6, as you get older, the baseline average temperature tends to drop and tends to have more variability. So my baseline temperature is, I've probably taken it 100 times in the past year, runs a flat 97.3. My wife, 97.1. It keeps dropping with age. That's my baseline. And then you're told to memorize that 100.4 is fever, 100.4 or higher. So if the average temperature is 98.6, and then you go to 100.4, that is less than 2-degree change. Now, let's apply that to my temperature. Let's say, now that I know my average temperature is 97.3, and I wake up one day and I'm 98.6 or 99.3. I'm not near 100.4, but I've gone up almost 2 degrees. That could be symbolic of a problem or fever, and maybe I got to get and call my doctor that I might have an infection. So everybody has a different baseline temperature, whether it's your kids, parents. You should know what that is, and you should write it down, because there are a lot of people who have baseline temperatures in the 96s and early and low 97s, like me and my wife, and they go up a degree and a half, and then they're told, oh, well, you don't have a fever. Well, but you've had a significant change and that needs to be watched. What is your baseline average temperature? Figure it out. Take a bunch of them over the next year and it will come out to a pretty solid number, whatever that is. The second point is invest in a small jar with a lid of coffee beans. What? Has Moyad lost it? Or something else with a distinct smell? One of the most fascinating things about COVID-19 in terms of symptoms was a strong number of individuals, some were the majority, some the large minority, around the world lost their sense of taste and smell. And that occurred with all my friends, for example. That occurred personally. And the reality is losing your sense of smell is something that was an early indicator. In fact, in also very young individuals that were infected. So once in a while, when I thought something was going wrong, I just took a smell there to see if I still had my sense of smell. I use coffee beans, but you can use tea bags, you can use whatever you want. But I have this just sitting on my office desk as a reminder that this is one of many, many ways that you can spend little money. And when you talk to your doctor, you can mention whether or not you've lost your sense of taste and smell when you're being evaluated. Anyway, the point is heart healthy is head to toe healthy is immune healthy. That's an important point. I like to say heart healthy is prostate healthy, but really heart healthy means the better you become in terms of heart health, the cleaner you become in terms of heart health, the better your overall head to toe health and immune health. Because the goal with prostate cancer, whatever cancer, is to live longer and better. And the number one cause of death in many prostate cancer patients, you look at active surveillance in other places, is actually cardiovascular disease. And it turns out anything that's heart healthy tends to have either a neutral or some activity against prostate cancer, but we know it's healthy from head to toe. So for 100 years in a row now, cardiovascular disease has been the number one cause of death in men and women, 100 years in a row. And so I want to finish up this part of the talk by telling you that, again, what I said at the beginning, if all I do is encourage you to pick up that phone, call your primary care doctor, talk to your oncologist about what other vaccines, adult vaccinations you still qualify for, I've done my job. Shingrix is the newest vaccine out there. It's 90 to 95% effective in the groups of 50 all the way up to 80 plus. And that also has, we talked about earlier, a company that's got that compound from the soap bark tree of Chile. It also has that as an immune booster in their vaccine, which is probably why it makes it so good. There's no live vaccine in there, but 90 to 95% effective, regardless of your age group. And the biggest problem with shingles is post-herpetic neuralgia, that debilitating nerve pain that can last for years. It also significantly reduces that complication. So it does what it needs to do. There's breaking news now from the CDC and Medicare database that people that get their shingles vaccine, it seemed to reduce their risk of different types of stroke. It turns out that if you can prevent a chronic infection or even an acute infection, like shingles, then you prevent a major inflammatory response in the body. And by preventing that major inflammatory response, you prevent the ability of certain vessels, like blood vessels, to become inflamed. You reduce the risk of that. You reduce the risk of a piece of soft plaque breaking out. So it turns out the side benefits of, I think, these adult vaccinations are going to be that they lower your risk of stroke and heart attack and cardiovascular events because they're heart healthy. They prevent that massive inflammatory response that can become chronic when you get the flu, when you get pneumonia, when you get shingles. In fact, there are several studies now in the literature which we're following where some individuals that were impacted by a severe case of shingles or something else, another infection that could be potentially prevented by a vaccine, saw a huge rise in PSA. And then when they were treated with antivirals, it reduced that. So there's all these things happening when there's this major inflammatory response. So I call COVID a cardiovascular disease too, meaning that I believe we'll wake up in 6 to 12 months realizing that the COVID vaccine and being protected from COVID not only prevents you from getting a respiratory infection, but also reduces your risk of a cardiovascular event because you're preventing that major inflammatory response from happening. Anyway, the side effects of Shingrix are pain, redness, swelling, muscle pain. But what you need to know is the older you are, the lower your risk of side effects. The younger you are with a more robust immune system when it comes to these adult prevention vaccines, the younger you are, the higher the risk of some of these side effects. The last thing I want to say is that lifestyle makes an incredible difference when it comes to your immune health. Lifestyle can impact your immune health in a way which we're just getting to appreciate. It was in 1985 where they looked at hospital employees who got the hepatitis B vaccine. And they found out those of a higher BMI or a greater weight seem to have less of a response to the vaccine. We've seen that now with hepatitis A, influenza, some influenza vaccines, tetanus, rabies, you name it. So we're not only seeing less efficacious with age, but some of our better vaccines are more efficacious with age as long as the person is able to take care of themselves and focus more on lifestyle changes. And any of that can matter in 4 areas. There are 4 areas that every prostate cancer patient and anyone watching this should know about in terms of numbers, besides PSAs and everything within their cancer. If they can keep their blood sugar under control, if they can keep their blood cholesterol under the control, if they can keep their blood pressure under control, and then their BMI, if they can lose some waist or weight to move toward a healthier weight, or at least prevent significant weight gain, those are the 4 numbers that are critical to everybody, not only trying to do their best to prevent a severe case of COVID, but also to maximize the effect they're getting from their vaccines, to maximize their heart health. And also, those are the areas that we're studying right now in research to get side benefits of going after, for example, prostate cancer. So these are all heart healthy benefits. When you maintain a healthy blood sugar, that's heart healthy. Same thing with maintaining a healthy blood pressure, same thing with a healthy cholesterol and a healthy weight. All those pay off from head to toe. I can't leave today. I have to call it quits. I've gone way over, which is fine. Sorry. I just had to get this information out. I just want to leave you with the most boring recommendation, but in a different way. I always like to talk about exercise and the importance of movement. Now, keep in mind, we use the word exercise. This doesn't mean you go crazy on a treadmill or do something high intense unless you want to do that. Exercise comes in many forms. There's aerobic, there's resistance, weightlifting, there's flexibility exercises, right? And then there's just balance exercises. So people don't fall, just having a better balance with age. Whatever your exercise. We talk about exercise for physical health. There's plenty in prostate cancer to suggest that physical exercise and exercise is not only heart healthy, but may have an impact on the tumor itself in terms of keeping it differentiated, reducing the risk of recurrence. Either way, we know it's heart healthy. So the most important thing of exercise, I think, though, in cancer is the mental health benefits. And I think that's the most important benefit of exercise in general. I think the physical health benefits get just way too much attention. They're fabulous. Everybody knows about them. The only reason I did a walk this morning before my talk in the neighborhood, did a little jog and a walk, was because of the mental health benefits. I just simply feel better. Everyone always says the same thing. They don't regret an exercise routine after it's done. That's because you get that endorphin release. So I like to always use these different acronyms with students. In terms of reducing stress, reducing anxiety, having antidepressive effects, if you're on medication or not, it only enhances the effect of the medication to work. So stress, anxiety, depression, hippocampus. What's the hippocampus? That's the memory centers in the brain. It essentially helps, we believe, maintain those memory centers. The memory centers of the brain, the hippocampus, are very sensitive to exercise. Some parts of the brain aren't. And so it's not a shock that in the American Academy of Neurology clinical guidelines, you can Google this in 2019 and 2020, people that had cognitive impairment, trying to prevent the transformation into dementia, into Alzheimer's, they now recommend exercise in their clinical guidelines to the students because there are a couple studies that show they're beneficial. And they have such mental health benefits that it helps not only keep you mentally sharp, but may help the progression and prevent the progression of certain diseases. So all these mental health benefits, not just stress, anxiety, antidepressant, but also the impact on the hippocampus overall. And another word that doesn't get enough attention in cancer or in pandemics is catastrophizing. Catastrophizing is just persistent negative thinking, which is very easy to do. I can understand in the early days of the pandemic, oh, am I going to get this? Everybody's thinking this way. Or when someone's diagnosed, it's easy. to start thinking and going in that direction. But what exercise does is reboot those areas and helps bring people back into more neutral or positive moods. But I think the most fascinating thing about exercise is not just the mental health benefits, but how study after study it shows it's enhancing conventional treatment and reducing toxicity of many treatments. So the benefits are so extreme that whether it's gardening, vacuuming, walking, swimming, you pick what works for you. A little bit of movement every day is having profound impacts, even if it's just in the area of quality of life and cancer treatment, which quality of life is critical. I'll get off my soapbox now and leave you with our Morky, Grazie. So I'm about to leave in a moment and he'll bite my foot and I'll have to enjoy it because he's still teething. And so he's probably going to rip the pair of pants I'm wearing, maybe even rip this Zero shirt. Sorry, Jamie, but this is what it's like to have a puppy. But I love this little guy, especially love him when he sleeps. And I love my Go Blue dog. So I put happy holidays because I always say that anyway in my talks. Thank you for your time and attention. I miss you all. Good night. Thank you to the Zero team. See you soon. And by the way, the most important thing maybe of my talk today is that I was and I will always be Cal Ripken Jr.'s best friend in my mind. I'm a Tiger fan, but I also love the Orioles. I love Cal Ripken Jr., and I'm really happy he's going to be here today. And I know that one day he'll declare me as his BFF. Thank you for your attention. Thank you, Zero. Thanks for spending all this time with me. And I hope you got something out of it today. Thank you.
So melatonin doesn't have anything to do with helping on COVID? Because I don't sleep very well, so.
You know, that's interesting you asked about melatonin, because melatonin is one of the greatest teaching examples of when someone generalizes on an entire category, I just roll my eyes. So if you ever bump into the person that goes, supplements don't work, they don't do anything, and I'm going, wait a second, melatonin has become standard for a lot of types of insomnia, including in certain kids. It's actually a prescription drug in many parts of the world. It's actually a prescription drug in the United States. People, since 2004 and 5, people don't realize it. So it's over the counter and prescription. So it has enough data that it really has a place in insomnia if you need it. But the reality is does it give you an immune benefit? And so finally in New York and several other places, they're testing that. So that trial's not done. So they're testing in a variety of places throughout the world, including the United States, high doses of melatonin, and the double digits would scare me because that can really knock you out, to very low doses of melatonin once you've been infected. They're also studying those in breast and prostate cancer. Will those work? I have no idea, but I do know that in studies in breast cancer, and they're starting them in prostate, they have helped people at very low dosages get more sleep in terms of quantity and quality. The biggest issue I see with melatonin in the United States to help with sleep is a quality control issue. So we talked about this with marijuana and CBD. You want to look for a quality control seal like a USP or a UL or NSF. Look for some kind of third-party quality control testing, but it takes very little melatonin dosages to help with sleep when people need them, 1, 2, 3 milligrams. People also forget that melatonin is used by pilots for jet lag. So melatonin has a place in medicine as a prescription and as an over-the-counter. I'll give you a really interesting example. We were dealing with someone who had a very advanced disease recently, and they had problems sleeping because of all the meds they were on. But they were adamant that they didn't want to take any of the current sleep meds because it came with their own list of toxicity. So they were adamant, and the doctor said, well, they don't. So it was interesting. I said to the physician that was taking care of this person, I said, well, you could prescribe Rosarum at 8 milligrams. And the physician said, I have no idea what Rosarum is. And Rosarum is melatonin that was approved as a prescription drug back in 2004 or 5. It's been out there, it's still out there. So it's a high quality prescription melatonin, and that's what the person used. And the reason why it's such an interesting example to me is that the over-the-counter world or the supplement world doesn't get enough objective education in healthcare. And the physician was very kind and said, I didn't even know this existed, because you don't see TV commercials that tell you this, right? You see them, and you don't see them anywhere else you travel. I went to Italy a few years ago. I had trouble sleeping, and one of my doctor friends in Italy said, I can prescribe you this amazing new drug. It's called Circadin, Circadin. And I said, I've never heard of it, so I'm not going to take it. He said, well, take a look at the website. And I looked, and it's 2 milligrams of melatonin. It's a prescription there. So to answer your question, of course, I'm excited about melatonin. It already has a place for certain people that have insomnia. Does it have a place in immune health? I don't know what I could predict. I think that's expecting a lot from it. But if it helps with quality of life and it helps certain people sleep that don't want more of the hardcore meds that come with its own line of toxicities, it's a wonderful example that should be discussed with your doctor for sleep. So it's a TBD, right? We're going to find out very soon if melatonin has any efficacy whatsoever as this hormone in terms of immune health and affecting COVID. We'll find out. The trials are all there and they're just finishing up now.
Gotcha. Thanks for answering that. Yeah, I mean, it could in a roundabout way if it's helping you sleep, and getting the sleep that you need is going to help with your immune system and be able to fight off infection. And
right, exactly. If sleep is so critical, and it helps people once in a while where they wake up and they have to take it in the middle of the night, and these low dosages help. The biggest problem, though, is becoming chronically addicted to these sleep meds, including any supplement sleep med. Because when someone becomes chronically addicted and they have to take it every single night, the reality is the next day it can create what we call sleep fatigue. So they're actually not fast on their feet. Their memory's not as sharp. Nothing works as quickly. You'll hear that all the time. So, but intermittent use once in a while, and for certain situations, it's been a wonderful over-the-counter prescription that really doesn't get the attention it should get. But it's so funny how we call supplements like their own category, but many of the best-selling supplements in the United States are actually prescription drugs in other countries, including this country. It's all perception versus reality. But isn't it funny how melatonin has all these studies in breast cancer patients to help with sleep during treatment, yet we are begging for them in prostate, which I hate to say this, Jamie, is another reason why I'm glad you guys go after research funding, because you need researchers out there like myself to get that kind of funding, because where else are you going to get funding for a melatonin sleep study in prostate cancer? It's not going to be easy to find that funding. It's got to come from advocacy groups. It's got to come from novel sources of funding, because we just don't have the companies out there funding those kind of studies.
That's right. That's why this week at the summit is absolutely critical, to be able to have like we talked about, be able to have the advocates get out there and talk to their elected officials about a variety of things that we're trying to do to improve access to care, including research funding.
Yeah, I mean, but I should quote you on this, that huge study done with melatonin in patients undertaking all these medications for prostate cancer. I'd love to quote it, but I can't because we don't have a study. So if you're watching, this is the reason why you advocate. The fact that we don't have a melatonin study, major study, to help some prostate cancer patients sleep, especially during some difficult times of treatments that disrupt sleep. It's embarrassing. We should have it. And it's not because researchers don't want to do it. The funding's not there. But the funding has been coming up now in breast and other places, so I'm optimistic it's going to happen in prostate. So sorry, you struck a nerve there.
No, that's terrific. I mean, it ties right back into what we're doing on the research front. It's critical to be able to look at some of these supplements and what they can do to be able to perhaps help prostate cancer patients. Having nothing there is just unacceptable.
Let me add one more point, which is really interesting. It gets harder to do almost anything as you get older. And people say, well, age is just a number. Well, yeah, but so is blood pressure and cholesterol. And, it's tough as you get older. I mean, I definitely can't do what I did 10 and 20 years ago. And sleep becomes more difficult. Not just with age, but with treatment. We know that. And it's more difficult to go into the deep phases of sleep as you become older, simply because the machinery doesn't work as well into putting you into more deep phases of sleep, putting you into REM sleep, which is the dream sleep, or putting you into NREM, like stage 3, which is deep, refreshing stages of sleep. So it's funny, many, many years ago, there were several studies funded where they looked at individuals as they became older, and they found that if they moved about 15, 30 minutes a day, they were more likely to go in those deep phases of sleep if they just did some form of exercise daily. There's something about exercise that allows the body to slip into more deep phases of refreshing sleep like you did when you were a kid, when you put in a little bit of movement time every day. That in and of itself is enough of a reason that everybody watching this should move a little bit every day, because it could enhance the quantity and quality of your sleep without having to pop a million pills.
Good point. It just reminds me to go put on my running shorts and get out there so I can get a good night's sleep.
Next time I see you, Jamie, we're going to hit the Washington, D.C. area, the Marine Corps Marathon. Did that one. We're going to go by the monuments. You and I will do like a 5K or a 10K.
Sounds good. Maybe not the marathon again. I've been there, done that too, but I'm down for a short run. I look forward to it. We'll make plans. We'll do it. Dr. Moyad, thank you again. We're incredibly grateful to have you as part of the summit again this year. Invaluable knowledge to know what's going on around COVID-19 and how it ties into prostate cancer. What's heart healthy? Is prostate cancer healthy, or prostate healthy? What's immune healthy? Is prostate healthy? And tying it all together in just the world we live in right now is just really invaluable information. I really appreciate you taking time and your energy and putting it into the summit for, on behalf of everyone who's watching it. Thank you very much.
No, I appreciate that. I think it's a wonderful time to be involved in prostate cancer in terms of research. And I find it fascinating that they're looking at cholesterol lowering, blood sugar controlling, all these heart healthy maneuvers to possibly help enhance the effect of prostate cancer treatment. But the good news is, if none of those work, you still win by reducing your risk of cardiovascular disease and enhancing your immune response. So heart healthy is prostate healthy, and heart healthy is immune healthy. And I hope some of this of what we talked about, which is highly unusual at a cancer meeting, is you'll realize the necessity of it and how it will help everyone watching live longer and better, and also pass that information on to the family and friends when they see it. So thanks for having me again. Thanks for my second keynote in a row. I'm making history here, Jamie. My second keynote. All right. I mean, you'll be lucky to even use my private cell phone anymore. I'm going to have a huge head after this. I won't even be able to get through the front door. I can walk around saying I'm the only person in the history of zero to give 2 keynotes. So even though Cal Ripken Jr. is a lot more famous than me, he has not given 2 keynotes, Jamie, has he?
No, he hasn't. He'll have to go after your streak.
Moyad streak at 2. We keep it going.
It's great. Thanks, Mark.
Thanks, man. I really appreciate it. Good talking to you as always. I'll talk to you soon.
Take care. Be well. Be safe.
Thanks, everybody.
Don't go far. We have exciting news. Tonight at 7 p.m. Eastern, 4 o'clock Pacific, you're invited to join our Bold for Blue award show. Our BBAs recognize 0 champions who have made the greatest impact in the fight against prostate cancer with their fundraising efforts, and some for their overall passion. Please join us for this amazing celebration as we kick off day 1 of our virtual summit.
The issues you care about most are right here at the virtual Zero Prostate Cancer Summit. Please check out the other topics, sessions, and virtual get-togethers in your Summit app. Remember, you are not alone. Join the Zero community to gain support and more information on prostate cancer at zerocancer.org.